I'll start out with history, a case history. This patient had mild Alzheimer's, and the caregiver went into the room to clean it and to ask if he had any questions. And the caregiver didn't really wait for an answer; just walked into the room. Patient got very upset that the caregiver was invading the room, and got very angry and started choking the caregiver. Luckily, the choking stopped right away when the caregiver backed away. And they called me. We ordered some blood tests, and I ordered a mild sedative. But then the patient did the same thing 3 days ago, and then 2 weeks later. And we were increasing the medicine. So I gave a presentation to all the caregivers about caregiver management. And the number one thing I recommend in this situation is when you knock on the room, don't go in until he opens the door, and don't challenge him on anything. You start saying, "How are you doing?" and stand back, and don't approach the patient on this until the patient's calm and the patient's agreeable for you to clean the room or give him his medicine or invite him to eat. So the caregiver needs to uh, be very attuned to the how much anger the patient has. Is it mild, medium, or severe anger? And then the caregiver needs to find out what the patient wants. What do they like? Do they like applesauce? Food to me is the first thing to calm someone down. Do they like applesauce, sandwiches, ice cream? When a patient's upset, don't worry about diet. Just give them something they like. Also, maybe they want to look at a photograph album of their loved ones. Men maybe want to put something together. You can have a little puzzle they like, or maybe they want to talk about uh, their old their old career as a painter, or uh, or a book or something. Uh, and then also recommended in this case to be very agreeable. The patient says, "I want a zebra. I want to paint the roof red. I want a steak dinner in 1 minute." Say, "Yes, I'll work on that. Yes, I'll work on that." Uh, so we will. These are the things I recommend. This video sample is part of my Caregiving Business Lecture Series on how to save money for your caregiving business, avoid caregiver burnout, and do better onboarding so you have less caregiver turnover. How is your business going? What are you struggling with? Where are you trying to go with caregiving? Our lecture series addresses all these issues. Saving money in your business is about teaching proactive caregiving and having better teamwork. For example, if you teach your caregiver about Alzheimer's agitation before the caregiver experiences it, then the caregiver will have more success and more work satisfaction. Also, the family will see this and the good calming effect of your caregiver. Does this make sense to you? Send us a message or click on the link below for more information. The better you take care of your caregivers, the better they will support your business.